Hey guys, so we are in the middle of discussing the anesthesia delivery system. So during the surgery, we know that we have to maintain the particular concentration of anesthesia, plus we have to uh, control the respiratory breathing system also. So during the surgery, these two things we have to maintain. First, the proper level of anesthesia means the patient should not be conscious. Amnesia should be there, so no formation of memory of the surgery. Then we have to give the analgesia and muscle relaxant, so sensory and motor system will be calmed down. So these three things mainly we have learned that included in the anesthesia, and this is beneficial for the patient who are going surgery for better experience, less pain, less post-operative side effects, and we can calmly do the surgery on the patient. So anesthesia is very helpful during the surgery, and we have discussed this three component in detail. We have discussed what are the pre-medications to be given to the patient for preparation of surgery, in which we have discussed that sedatives, anxiolytic, and amnestic, which is benzodiazepines. Then for pain relief we are giving this morphines, and for all the secretion control we are giving glycopyrrolate. For acid secretion control we are giving proton pump inhibitor, hydrogen pump inhibitor, and we are giving broad spectrum antibiotic. And post-operative nausea and vomiting reduction we are giving ondansetron or metoclopramide. So all of these things we are doing just for the patient to get better after the surgery, to reduce the complication, post-operative complications during the surgery, all the complications, and for better experience of the surgery to patient as well as the surgeon. Now we have prepared the patient, we have done the pre-anesthetic checkup, we have prepared the patient for the surgery, monitor all the drugs, nil per hour period is maintained. So we are now fully prepared to do the surgery on the patient. So first we have to give the anesthesia, and we are learning about this now that we have prepared the patient. And do all the mandatory process required before the surgery. So before giving the general anesthesia, we have to maintain the respiratory system, because general anesthesia is going to interfere with the respiratory centers and going to depress the respiratory centers. We have to ensure that patient's breathing is stable during the surgery, during the anesthesia. So this two things we have to maintain, and for that we have developed a proper system to ensure that all this thing is going well. Now In anesthesia delivering system, we have classified into these three types. First is the source of the gases, then all the regulatory system within the anesthesia machine, and the third one is the circuit that is going to deliver all this thing to the patient in very controlled way. So breathing circuit is, let's see, the breathing circuit is mainly of four types: open, semi-open, semi-closed and closed one. Now let's first discuss about the open circuit. So in open, there is no tubing, no reservoir bag, complete contact with the outer environment will be there. Means in this kind of anesthesia, there will be no any anesthesia machine, no any gas cylinder or pipeline that is going to deliver to the patient. So we are completely using the environment air, plus for the anesthetic agents we are using this contact open drop method, in which we are using this mask that is known as Schimmelbusch mask. So open drop method means in mask we are going to just dropping the few drops of ether and chloroform and just putting on the patient's nose, and there will be just environment air will be used. No tubing, no anesthesia machine, no gas cylinder, nothing. Just the open drop method and use of this mask. So in complete contact with the environment. This type of anesthesia is known as open method. Now the semi-open and semi-closed, both have reservoir bag, but in semi-open method there will be no rebreathing, and in semi-closed method there will be partial rebreathing. What is the use of first this reservoir bag? So various use for the reservoir bag, let's see. What is the function of the reservoir bag? In which it is to provide a reservoir from which additional gas may be drawn should the respiratory demands of the patient exceed the gas flow delivered from the machine. Means function of the reservoir is mainly to provide high concentration of oxygen quickly, typically in a hospital or emergency room or in an ambulance during transportation to a hospital. Means this reservoir bag we can directly just give the flow of all the gases to the patient just with the pressure control valve, or with or without pressure control valve, and without tubing also that can be done, and without reservoir bag also can be done. But why we are providing the reservoir bag in some condition? Because reservoir bag has many functions, like reservoir for the anesthetic gases and as a means for manual ventilation. Means we can do manual ventilation if needed in the emergency procedure, and we can also give concentrated gases in case of there is emergency. So reservoir means there will be some accumulated concentrated gas will be there. If needed by the patient, it can take from that. And for manual ventilation also, plus we can also monitor uh, the patient's ventilation by allowing visual assessment of the presence and estimation of the volume of the ventilation. So this is actually the use of reservoir bag. Okay, so I have included the function of this reservoir back in this. Now, in this semi-open type of method, the most common one is Mapleson circuit, and in this there will be no rebreathing. The reservoir bag will be used as a reservoir, but there will be no rebreathing, means no rebreathing of the expired air. And here there will be partial rebreathing, and here will be complete rebreathing. And in closed type there will be no contact with the outer environment is present, so it will be more economic, less OT pollution, less risk of fire, and heat and humidity will be preserved in this. Okay, so you can see the different type of Mapleson circuit: A, B, C, D, E and F. So let's see. So in Mapleson circuit there is two things. This APL means adjustable pressure relief valve. This is APL, and wait, yes, APL. So APL and fresh gas flow means FGF. Two things will be there: fresh air flow and adjustable pressure valve, that is mainly present in all of this except for the E and F type, in which it is mainly used for the children, and there will be no need of adjustable pressure valve. So in A, B, C, D there will be present of APL. By location of this mainly we are dividing A, B, C, D, E. So A means APL will be adjacent and fresh gas flow will be distance. And in D, totally opposite, fresh gas flow will be adjacent and APL will be distance. And in B and C, B both will be adjacent only, and in C there will be no corrugated tube present, just this two thing will be adjacent to the patient. Now, and in E and F we know that there will be no APL, but what's the difference? In E there will be no reservoir bag also, and in F there will be just no APL, and both E and F will be used in the children. A's is Ayard tube and F is Jackson rail. Okay, and A is McGill circuit and D is Bain circuit. If A is coaxial, we known as Lex circuit. A is circuit of choice for spontaneous ventilation, while Bain's is circuit of choice for controlled ventilation. Now let's learn about the closed circuit. What will happen? That expired gas will passes through the soda lime and it will absorb the carbon dioxide. So requirement of the fresh gas flow will be decreased, and the component of soda lime is important, mainly soda lime. So calcium hydroxide and sodium hydroxide will be there. 94% will be calcium hydroxide, 5% will be sodium hydroxide, and also 1% potassium hydroxide will be there. And what's the function? That NaOH will act as a catalyst while KOH act as an activator. Each 100 gram of soda lime will absorb 28 liter of carbon dioxide. So in core part there will be soda lime, outer cover will be made up of silica for hardness. So this is mainly the composition of the silica, I mean the soda lime and silica. Now contraindication. So trilene is not used. Reactant forms dichloroacetyl phosgene, which is neurotoxic, and sevoflurane compound A will be nephrotoxic. Now alternative, it is berry lime, in which calcium hydroxide 80%, beryllium hydroxide 20%, and 9 to 18 liter of CO2 absorption. Higher incidence of airway fire will be there, but and berry lime plus dash fluorine. Now in previous one, sevoflurane with soda lime, berry lime dash fluorine, carbon monoxide will be formed. And Amsorb is a new CO2 absorber. Content will be calcium hydroxide 75% plus calcium chloride and calcium sulfate less than 1%, and no drug interaction will be seen in Amsorb. Indicator is added. Change color of soda lime changes color on exhaustion. An indicator most commonly used is the ethyl violet, other are phenolphthalein, mimosa Z, clotine yellow, and soda lime granules. 4 to 8 mesh size and hardness occur due to water crystallization. This was about the open circuit. Now we are learning about various wait we are learning about mainly airway management, and there are various type of airway management devices are there. So let's see.